And thank you, Cheryl. Thank you, Cheryl, because I've already had 3 or 4 emails this morning saying that they couldn't make the meeting, but they wanted to make sure they got a recorded version of it. So we're going to do that. And right now, then, I'm going to introduce Brooke Pace. As I said a little earlier, I think with all the new facilities and the new events in healthcare in Wallowa County, which we are blessed with, and the concurrent rise of COVID, questions about healthcare have become very current, and they certainly changed the operation of our Josephi Center. For your information, we have a show up now, the remnants of the Wallowa Valley Festival of the Arts. We had to do a very much more limited version of that, but we are open. We do require masks, and we have them to give out at the door. And I wish to heck all of our businesses did, but they don't. Okay, with that, you know my prejudices. Brooke Pace grew up in Wallowa County, ran away for a while, lived for a while and worked in wine country in Wallowa, came back here and reconnected with an old classmate and got married and has a couple of kids. And
Just
David
like
and pardon?
Just like that.
Just like that. There they are right behind her.
Yes.
Her husband David and her kids, and I forget their names. But anyway, Kelly is Brooke is communications director for Wallowa Memorial Hospital. And I've asked her to kind of give us a report of the hospital and then be ready to, and a little bit about how they're handling the COVID crisis, and then open it up to your questions. So with that, and when we open it up to questions.
Okay. Fantastic. Yes. So I thought I would start out with just a very brief presentation of an overview of the district itself, what it includes, how we're related to all of the entities in Wallowa County. And then I thought, you know, the COVID situation changes so quickly. I thought that after I'm done with my presentation, I would just open it up to questions that you have specifically, and I will do my very best to answer those questions. So without further ado, oh, Richard's saying that I can't share my screen. Is there any way I could share my screen so I could show?
I just fixed it, Brooke.
Oh,
I fixed
fantastic.
it. Yeah, sorry.
Thank you.
I should have done that at the beginning.
That's okay. Here we go. All right. Is everyone seeing the screen now?
Yep.
Yes.
Okay, fantastic. So like I mentioned, I just want to do an overview and a little bit of history regarding the district and who we are. Wallowa Memorial Hospital was under the control of the Wallowa County Board of Commissioners for over 40 years and consistently struggled financially, minimizing the ability for service growth and technological and facility investments. The hospital competed with other county departments for operational needs within tight county budget challenges. The healthcare district was formed in the early 90s to transfer the financial and operational control to a locally elected 5-member board and a professional executive team. The current board of directors is made up by board chair Nick Lundy, Vice President Bob Williams, Sue Coleman, Kate Loftus, and Nancy Crenshaw. In 1992, the voters approved yearly tax assistance directly to the district to help enable increased services, quality, and staffing. Currently, taxes make up about 3 to 4% of the district's income and are crucial in ensuring exceptional health care. The district model underscores community ownership of the hospital, local control, and long-term commitment to ensuring top-level acute care, outpatient, and clinic services to further generations. people often have questions about which entities fall under the healthcare district's umbrella. So I thought we'd just look at those a little bit closer. The first, of course, is the hospital. In 2007, the citizens of Wallowa County celebrated the opening of a newly constructed Wallowa Memorial Hospital, replacing one that had been built in the 1950s. At a cost of $23 million, the 25-bed critical access hospital is a level 4 trauma center and serves the residents of our beautiful county. With the building of the new hospital, healthcare in Wallowa County was brought into the 21st century and has really become a model of what rural healthcare can be, receiving awards that include a place on both the top 100 and top 20 critical access hospitals in the nation, now for several years running. We've also been named a top place to work in healthcare for the last 3 years. And we just got word that we came in at 15th overall for 2021. So excited to make that announcement. The incredible challenge of building a new hospital in a rural area could not have been met without the support and resolve of this community. It was because of the generosity of so many that allowed for a far-off dream to become a reality. Thanks to the investments made, Wallowa County has attracted and retained top quality medical talent. Our community continues to support our healthcare system through the Wallowa Valley Healthcare Foundation that was founded in 1991, and the Wallowa Memorial Hospital Auxiliary, which has been raising money to support the hospital since the 1950s. Next, we'll look a little closer at senior living. So even though Wallowa Valley Senior Living technically falls under the district umbrella, because of detailed accounting rules related to hospital services, it's significantly financially advantageous for senior living to have its management connected to an outside professional management organization that answers directly to the district board of directors. This model has moved senior care from having major financial deficits to achieving close to a break-even operating status. The management company that oversees senior living is called Sapphire Health Services. Sapphire Health Services is located in Portland, Oregon, with 50 years of combined experience from the founders. Sapphire has developed a portfolio of healthcare businesses that include independent, assisted, and skilled nursing centers. This knowledge base is evident through the exceptional and quantifiable service outcomes provided to the residents and the clients, like the healthcare district. So I just want to address quickly, we had heard some rumors about senior living closing because of staffing issues. And so last week I reached out to Lisa Hilty, who's the VP of Operations for Sapphire, and this is what she had to say about that. Our healthcare workforce statewide is in a challenging time, and Wallowa Valley Senior Living is not immune to these challenges. Thankfully, we have been successful and continue to be at staffing to meet the needs of our cherished residents. We are honored that people have stepped up to volunteer or to take on roles within our team. And I just wanted to add with that, if anyone listening right now has any interest in volunteering or working in the senior living community, I really encourage you to reach out and give them a call. And their phone number is 426-5311. So next we'll take a little closer look at our clinic systems. Wallowa Memorial Medical Clinic has a history of serving the healthcare needs of Wallowa County since 2015, when Wallowa Mountain Medical, formed in 1991 by Dr. Boyd, joined the Wallowa County Healthcare District. We've had a few name changes since then, and for simplicity's sake, are now known as Wallowa Memorial Medical Clinics. For greater access and convenience, we now have 4 clinic locations, 2 in Enterprise, 1 in Wallowa, and a new state-of-the-art rural health clinic in Joseph. We currently have 9 providers, and they include Dr. Kirsten Kane, Dr. Emily Sheehan, Dr. Kelsey Allen, Tracy Fry, FNP, Jennifer Little, FNP, Michael McDonald, FNP, Sarah Peterson, DNP, and our latest additions that we're just very excited about, Paul Solis, who is a certified physician's assistant, that's a bit of a tongue twister, and Katie Weller, who is an FNP that specializes in pediatrics. Also on our roster, we have 2 mental health professionals, Dodie Beck, who is a licensed clinic social worker, and Erica Gilliland. We have a general surgeon, Dr. Rose, who performs procedures out of the hospital and clinics. So many of you are aware that we have purchased the building along the highway in Wallowa that formerly housed Fox Archery. Just to give you an update on that, we're currently working with an architect to nail down the design of the new clinic. The rough timeline looks like this. We are planning to go out for bid and construction in November. Construction will then start as soon as possible with a target opening date of September of 2022. In the meantime, we're now open in Wallowa 5 days a week, with one of those days being designated to seeing mental health patients. All of the clinics are rural health clinics. What that means. So RHCs go through a strenuous federal certification process in order to benefit from reimbursement plans from Medicare and Medicaid. Nationwide, there are over 4,500 RHCs. And being an RHC allows us to offer financial assistance for medical expenses to anyone that falls below the 400% of the poverty line in different degrees, regardless of insurance status. So that's an overview of everything that's covered in the healthcare district. And then I'd like to just touch on some of our very important community partners, as we receive a lot of questions on how we're related to the Wallowa Valley Center for Wellness and Winding Waters Clinic. So both of those organizations are independent of the hospital, but we work together on many important services for our community. Winding Waters physicians are an incredibly important piece of the hospital medical staff and leadership, and we couldn't do what we do at the hospital without them. So like I mentioned, that's an overview of the district and who we are. And then if I can figure out how to stop sharing the screen, there we go. I will then jump into the COVID conversation. And Rich, I don't know how you'd like to facilitate the asking of the questions. I have a pretty general knowledge about the situation overall. I don't know if people raise hands or type it in, but I'll let you take it over and then I'll do my best to answer any questions that everyone may have.
Well, I think people can type a message into the chat box, or you can just shout out, I guess. We'll see how that goes. If there are a lot of people that want to talk at once, we'll go in the chat box and do it that way. But I don't know. I would just start off, and somebody's already asking about testing capabilities. Do you have rapid test capability, et cetera? Do you want to start with that, or do you want to start with?
Yeah, I can absolutely start with that. So we both, and I saw Nick was on here somewhere, Jesse's on here as well. Both of our clinics certainly have the ability for rapid tests. There are, testing has been one of those things that supply and demand has really kind of molded how we test. So the rapid tests are used as indicated. So for people who are experiencing symptoms. So if you're just curious or traveling, typically the rapid test won't be done. We'll use a send-off test. However, if you've had an exposure or an experiencing symptoms, that's when the rapid tests are being utilized. But yes, we certainly have both clinics, all clinics in the county certainly have the ability for rapid testing.
So anybody, if your primary doc is Winding Waters, you go get your test at Winding Waters. If your primary doc is at the clinic in downtown Enterprise, you go there for your test, right?
Absolutely, absolutely.
Okay.
And just to note, currently we do not have hours at Wallowa Memorial Medical Clinics on Saturdays. So if you're needing a rapid test, if you're feeling under the weather and are interested in getting tested, I know that Winding Waters is testing patients on Saturdays as well. Correct?
Okay.
Perfect.
So Mike Ing, he said a PCR test. I don't know what a PCR test is.
So those would be the send out tests that actually go, that we send those. It's a different test. It's a nasopharyngeal test, so it gets a little further back, and then those are sent out to a lab to be evaluated. We do have some in-house testing of those types of tests that we specifically use for pre-procedure tests, and also when we're admitting inpatients to just help protect the safety of the hospital.
Brooke, could you could you kind of run us through how the hospital is organized right now in regard to incoming COVID patients and other patients? I know you
Absolutely.
have some rooms set aside and all of that. Can you give us a rundown there?
Yes, so that's really a kind of a moving target question. I checked in this morning just to see where we're at. We currently do not have any COVID patients admitted into the hospital, which is a great thing, but could change in the next 5 minutes, as you know. The way that we call it our surge plan, the way our surge plan is set up, we have a designated COVID patient room, and then if we exceed that capacity, we move out to a designated COVID wing that has more beds available. We have, at any point in time in the pandemic, we've never had to expand beyond the designated COVID wing, which involves chambers coming down and really isolating that whole portion of the hospital. And if we were ever to get to a point beyond needing more capacity for COVID patients beyond that wing, part of our surge plan includes repurposing some of the areas of the hospital to move what we call clean patients. So we of course have the medical office building next door, which there's different phases along that plan that would involve setting up beds in the physical therapy area and then moving down into the clinics. The extent of our surge plan on campus would add another 21 beds if we ever get to that point to be able to make those additions. And then beyond that, you know, given a really dire situation, the surge plan also includes utilizing the Cloverleaf Hall for clean patients. So
Wow.
in this moment, right now, we're doing pretty good. You know, I'm sure some of you have been watching as we've been doing different PSAs that in the last month, there have been a number of times that we have been on divert status and we have not been able to transfer patients out. Hospital capacity throughout the state is starting to look a little better, and we haven't had as large of an issue transferring patients out here in the last week. It's still not a given, especially with the challenges that our neighbors to the east. I'm sure you're all aware of what's happening in Idaho, and the hospitals that we would typically transfer to, we're not able to, but we're still able. At this point in time, we've had success in getting patients out. So that's something that can change incredibly rapidly. One thing that is in the works right now, just as being a good partner, St. Joseph's, which is a hospital that we transfer to quite often, is currently under a term that I'm sure you're all familiar of as crisis standards of care, as is the whole state of Idaho, where they're really having to
Triage.
there you go, triage the healthcare services because they don't have enough beds and enough staff to take care of everyone that needs taken care of. So we're currently trying to work with them where we're not on divert and we do have room at our hospital right now to perhaps take some of just what we call the normal hospitalized patients, not COVID patients, that require a level of care that we could provide here to then in hopes ease some of their burden. So if we do have a COVID patient that's needing a higher level of care that we cannot give them, that we could send patients their way. So a part of being a good neighbor and partner to just try and make the situation a little more manageable for everyone.
So when it sounds like you have transferred some patients out, then what's the critical point? What don't we have here and when do we have to send people out?
So we don't have the biggest factor, and there's all kinds of things, just like I was mentioning, we're a level 4 critical access hospital. The biggest thing, the biggest factor is that we don't have an intensive care unit here. So anyone who's needing ICU care would need to be transferred out. And that isn't specific to just COVID. That is really for anything.
Okay.
But our lack of an ICU is really what generates the majority of transfers, especially with COVID. We have had,
Dr.
go ahead.
Oh, go ahead.
I was just saying,
Or I was going to say,
we have, when we were here a few weeks ago, when we were not able to transfer readily, we have cared for patients on ventilators. It's something that we have the ability to do, and given normal circumstances, we wouldn't be taking those patients on. We would be transferring them out.
okay. Other people, step up there with your questions and concerns. Huh?
Yes, John, I see you raising your hand. Go for it. Oh, you're on mute, I think, John.
Mute. Can I unmute?
There
Am I muted now?
you
Okay.
are.
I've been here for all of, I think, 5 days. And my question to you is, which Medicare Advantage plans do you
Oh
accept?
goodness, John, that's a question I'd have to get back to you on. I know a little bit about a lot of things, and that's not one of the specific things that I have knowledge of. So rather than trying to make something up, I'd love to get that question answered specifically for you.
Okay.
Absolutely.
Okay. Well, while other people are thinking up their questions, Brooke.
Yes.
Okay. So
I know.
you and I talked a little bit.
I was just going to say, Rich,
Okay, we talked.
Go ahead. I'm sorry. I'm stepping
Go
over
ahead.
you. I was just going to say, I know that the vaccination rates and those types of mandates have been a hot topic. So I thought that perhaps I just give a little bit of information around that and see if that spurs any questions. So as I'm
Perfect.
sure everyone is aware, in the state of Oregon, healthcare workers, regardless of what setting you're working in, so it could be the hospital, it could be a clinic, it could be a dentist office, it could be a chiropractic office, are now, as of October 18th, required to be vaccinated. And the state is reporting on a county level the healthcare worker vaccination rate. And this is the latest number that has come from the state, just to kind of give an overview of the entire county, not specifically the hospital or the clinics. Right now, 70% of as of September 6th, 70% of our healthcare workers in Wallowa County have been vaccinated. So people still have a little bit of time. October 18th is the cutoff. And before the vaccine mandate came out, there was some regulations that came out around testing of unvaccinated healthcare workers. And so starting this week, anyone working in the hospital or our medical clinics that is not currently vaccinated, on top of additional screening questions, will undergo weekly testing. And so that will continue after the 18th comes about for anyone who has filed for and been granted an exception or an exemption for either medical or religious reasons. So just to kind of a snapshot of where we're at with our healthcare workers in Wallowa County. I know a lot of, just anecdotally, there were a number of people that weren't necessarily opposed to receiving the vaccine. They were just kind of waiting to see, and this has pushed them. So I suspect that when the next set of numbers, which is coming out monthly, rolls out for the percentage of healthcare workers vaccinated in Wallowa County, that we'll see an uptick from that 70%. Then when we talk about vaccination rates for our entire county, the most current numbers that we have is that of the population 18 years of age or older, we're sitting right at 64.1% of people vaccinated. So far below what we would like to be, you know, the kind of golden number that we talk about when we talk about reaching herd immunity is 80%. So you can see quite a long ways to go before we hit that mark. And that to get to 80% of the vaccination rate per state numbers, we need to vaccinate 919 more people. So I'm hoping that everyone on this call has had an opportunity to chat with their provider about the vaccine and to make that decision, and to also tell your friends to do so as well, because it will be a lot easier to vaccinate 919 people than care for 2,000 people that would need to become ill to reach that 80% ratio.
So how does that compare with we're a little better countywide than our neighboring counties, as I understand, than Umatilla or
Yes. Union County is a bit below us as far as healthcare workers. The last numbers, they were a little bit higher, but for both numbers, we're falling at the top of the rural counties, but still below some of the more urban counties. So about middle of the pack.
I was going to ask you the numbers on healthcare workers.
Yes.
So that's 70. I don't know, but about the rest of you out there, the civilian population, but 70% seems very low for healthcare workers. Right. People that deal with this every day, the expectation is that it would be higher.
Yes. And like I said, that number was current as of September 6th. So it certainly is higher right now than those numbers, but it's just something that's been updated on a monthly basis.
So Clay Josephi, who's a doc practicing now in San Francisco ICU, asks about, he says that he'd like you to comment on medical exemptions. He says that in his situation, there are very, very few medical exemptions.
Absolutely. So really the only true condition that is qualifying for a medical exemption is previous reaction to the vaccine itself. So if someone received the vaccine and had an adverse reaction, meaning anaphylaxis, something beyond just I didn't feel well for a day after the vaccine, or have had proven allergies to any of the components in the vaccine, those would be the two things that really qualify for the medical exemptions right now.
And what about the religious exemptions? Do you have to show your church membership, or what do you have to do to get a?
Sorry, someone's knocking on my door right now, even though I put a big Post-it note up. Please do not come in. I'm in the middle of a presentation. So those, of course, are a little more tricky because it's really hard to decipher what is in someone's heart. So here within the healthcare district, we're following OHA's guidelines. There's a form that has to be filled out. There's an approval process where we have a committee that's reviewing these to determine, the true statement of the exemption. And then, of course, these can all be audited by the state as well.
So I understand from Dr. Maley a couple of weeks ago that I, as a patient, if I come into the hospital, I can ask the hospital staff that are dealing with me, I can ask them if they are vaccinated. Is that true?
You can, absolutely. It is every person's own right to either share that, everyone has different feelings on this, to either share that information or not. The one thing that I can tell you is that if someone's choosing not to share it, it's not necessarily because they're not vaccinated. There's a lot of opinions about the mandate and making vaccine status public, but also that for people, the small percentage of people that have qualified for an exception, just like I mentioned, are going through strict weekly testing as well as additional screening to make sure that and as everyone knows, will be in appropriate masking and eyewear to make sure that there's no risk of exposure to patients.
Yeah, of course, that's the big issue here. I mean, we're asking at the Josephi Center that anybody that teaches a class be vaccinated.
Right.
Okay? And we just think that's common sense. You're exposing yourself to a bunch of kids, which leads me to another question. Where are our schools in this whole deal, and how are you working with them?
So we,
Or how are you
in terms of vaccination rates, I don't have the answer to that. I haven't looked at to see if the education department is reporting those numbers. We have been working with the schools, primarily the superintendents, very closely. Dr. Powers has done a number of meetings and information and frequently asked questions lists to make sure that everyone has all of the information that they need. I'm not sure how the Department of Education is handling their exceptions and people who have qualified for an exception. The state regulation, the mandate says that reasonable accommodations will be made to keep students, patients, whoever it's affecting, safe. And so the way that the hospital has interpreted reasonable accommodations, it's through weekly testing. And I would assume that the schools will be required to do something similar.
We've heard that we've had a few quarantines in our school, schools. Who manages them?
The quarantined people?
Yeah, who from the healthcare business works with the school when there's an exposure and a quarantine in a school to ensure that it's done properly?
Absolutely. So we have two experts on the matter. I think I saw Nick and Jesse both on here. Winding Waters is absolutely handling the contact tracing and contacting, getting the contacts from the schools and then contacting the individuals. Nick or Jesse, would you like to comment on that?
Yeah, happy to provide some perspective. And thanks, Rich. So we are, and I guess for folks that may not know me, I am Nick Powers, the CEO of Winding Waters Clinic, which is a nonprofit community health center and good partners with the hospital. We are responsible for the case investigation and contact tracing for COVID cases in the county. And so that includes working with people who have tested positive wherever they were tested, if they have a Wallowa County address, and following up with contacts, and then following up if and as required with schools or others.
Okay.
And I would say that's specifically because, and as one of the participants today brought up, we do not have a local public health department. The Oregon Health Authority has responsibility for local public health. And so for different pieces of public health work, they work with different local partners.
Thank you, Nick. And just to share that, or maybe if one of you want to comment more on that, but we do not have, we at one time had a public health department in Wallowa County. We haven't had for several years. So the Oregon Health Authority is responsible for essentially our public health agency. One of the problems with this, which I've heard some exasperation on the part of some healthcare providers, is that, for instance, statistics get ground up in the bureaucracy somewhere there. And so, for instance, we showed that we had 6 deaths due to COVID for weeks and weeks. And we all knew people who had died, or not all of us, but several of us knew people who had died. And it took a long time for that information. And I don't know how current they are today.
Right. Absolutely. And that is something that, we're very aware of, and it's also been made very clear that even though we might be aware of those situations. We're not able to share that information because of HIPAA standards. And so myself, Stacy Karvosky, who's our quality improvement director, Dr. Powers, Jenny Word, who's our CNO, we all have and I'm sure Nick as well, have very regular conversations with our liaisons at the state. And when we see a lag like this, are doing everything that we can to be the voice of Wallowa County to encourage that information to get out in a timely manner. So we're certainly working hard to make this relationship work as best as possible for the community. But of course, it doesn't always work out perfectly.
There's
Yeah,
an
if I may,
interesting,
just to reinforce what Brooke said, and as I saw the kind of marketing for this, I'm here just to help fill in gaps because no one person can know everything that's going on. So
I appreciate that, Nick.
I know, just want to be helpful if I can. Yeah, we've all been told very clearly from the state, you cannot announce anything publicly until the OHA does it first. So we all feel a little stuck on that. And as Brooke was saying, no catastrophes are going to be revealed, at least to this point. There's no big secret stuff happening that we can't tell you. Just have to wait for them to make some of the public announcements. But my understanding is they're caught up again.
okay. Mike came back with another question on PCR. So when you do the quick test, how do you determine who to do the more accurate, longer test with?
So
I guess.
the
Rick,
quick test,
could you read that whole question, please? Because I think the percentages are important for people to understand.
Well, he says, given that the best of the antibody rapid tests are only 55% accurate at correctly identifying a positive COVID case, meaning that 45% of these tested could indicate negative, but actually be positive, how do you decide whether or not to do a PCR test, which will provide more accurate results?
and those percentages are for anyone receiving the rapid test, and that's why we specifically use them for people who are symptomatic, that it's already pointing in that direction. So at that point in time, it's more of a confirmation as opposed to people who are not presenting with symptoms or have not had an exposure.
Okay. So Mike, do you want to step up yourself?
Sure, thanks. I'm still confused about the testing protocols. If the rapid antibody test is, it's about half accurate, and
I guess maybe I didn't communicate that. I don't have the percentages right in front of me, Michael, but it's more accurate than that with patients who are experiencing symptoms.
so then
Nick, do you know the numbers? It's over like 90% for symptomatic patients.
I think it depends on how soon in the symptomatic process they are.
Exactly.
Yeah, I don't know the numbers, but I do know it's much better for folks with symptoms. And I also know that the PCR testing is still, it takes time and supplies are more limited. So my understanding
I guess what my concern and question is, if somebody thinks that they may have been exposed and could potentially either, maybe they're asymptomatic, but they've had a direct exposure to someone that has a confirmed COVID case, and they're wondering, oh, I wonder if I have COVID or not, and they take the rapid test and it says negative. Well, they could be an asymptomatic carrier, and they could then expose their children, elderly people, other people that are at risk. And there's maybe a 45% chance that they actually are positive, but the rapid test said negative. And so they go about and do their business without taking additional precautions that might be warranted given the inaccuracy or the the inaccuracies in the rapid test? That's my question.
And, that is very much a concern because you can purchase these rapid tests on Amazon or at Safeway, and not using them properly certainly does create a risk. So the only time that we use them within our health system, and this goes back to case investigation and contact tracing as well, is if someone is trying to test out quarantine, so you've been exposed, you have an exposure, you've been asked to quarantine, and someone's interested in testing out, that the testing capability isn't available until 5 days after the exposure. Is that correct, Nick? It's 5 days after. And so, by that point in time, post-exposure is when symptoms would start to develop, and that we would utilize that type of rapid testing. So it certainly isn't perfect. However, given the time that it takes to send out PCR testing, as well as just the supply chain that has really been, up and down, that's the best way for us to utilize all of the testing that's available to us in the most accurate way.
I appreciate the constraints that you're under in trying to do this, and very much appreciate it. I guess my concern is that people don't assume that since they tested negative on a rapid antibody test, oh, they're good to go. And, even if they've been exposed, a known exposure, they could still be an asymptomatic carrier, even if they were vaccinated, and they could be spreading this to vulnerable people. And I don't think people generally understand that. They think, oh, I'm good, I'm negative, the test came back negative, I'm good to go, I can do anything now.
Absolutely. No, and it's really great for me to hear that concern, Michael, because we try and do weekly updates just on things that might be on people's minds, and we get some of our providers and of course Dr. Powers to speak about those types of things, and I'll certainly put that down as a topic to be addressed on a public PSA.
And if I may, there are two pieces that I would add, and Michael, you're exactly right. It's not, that negative test is not really a get out of jail free card. And we were just having a conversation about it this morning. How do we try to communicate that better as we're testing a lot of patients? The other piece that I would add is just that I learned, I think just yesterday, that the test, the Oregon Department of Education no longer allows testing out of isolation for right now because of this Delta surge and the touches on the schools. And so I had just heard that yesterday. That was a surprise to me because I thought people could test out, but that's a precaution ODE has decided to take with the schools that's causing some significant concerns locally, because people got used to the idea of testing out. And now we're, as local healthcare providers, having to explain this and getting some pretty strident feedback that people are not happy about it. And it's something that ODE is requiring.
Interesting.
I wasn't aware of that, Nick. So
Yeah, no, it's literally I think just last night, and Jesse may have had to step away, but like this just is coming up yesterday as some, as we've learned about a touch on the school and how frustrated people are that they can't test out in order to get back to school.
Absolutely.
On the other hand, we've had quarantines, at least at a couple of our schools, haven't we already this year?
I believe so.
Yes, and you see me thinking, I'm like, okay, which parts are public and which
Right,
parts
can
are
we
not?
say this? Yes.
And so I don't want to accidentally disclose anything that the OHA hasn't yet. That said, there aren't like huge disclosures coming. And yes, we've had touches on the schools, and the rules continue to change, right? And so as we try to communicate the public, and we don't have a local public health department to help with it, we only have the OHA. It's like, oh, we aren't making these rules up. We aren't enforcing these rules. We're advising you what the rules are. And it's up to, OHA and the schools to make sure that we follow them to the best of our ability.
So putting all of you healthcare people on the spot, is this an argument? I've heard other reasons that people have missed having a public health department here. Is there any, might this push the idea forward again? Might we be missing other things by not having our own public health department?
No, I
I mean,
think
we've
if
got this, when we had the public health department here in the, go ahead, Brooke.
Oh, no, that's okay. I was trying to say, I think you asked most of our community members pre-pandemic if they noticed they were missing out on anything from not a health department. They would have answered no, because all of our community partners have taken on a piece of that role, fashion. Really, the this pandemic has really brought to light the income that is controlled by OHA, and without it, I don't know that we would have noticed. It's certainly been great job security for me, not having a health department, being the communications director at the hospital. And I think that here in Wallowa County, we are a group of people that like to be independent and stick together and have some grit. And I think that relying on the state organization, people are weary of government right now. And so perhaps our message hasn't been as clear when it comes from the state on the precautions and things to do, and why it's important to get vaccinated and all of those things. So we really tried to make sure and be delivering the information directly from the source. I reference our public service announcements that we're doing from our chief medical officer and from our local providers, so that people understand that this really is the message coming from your local healthcare community, and it's not just regurgitating from the state.
Yeah, in addition, I think is that for the county would have to want to bring it back. And it was getting so very expensive for the county to afford it. So my understanding was that most of the funding for the health department was coming out of county coffers. So things, and I think beneficial things that all these local partnerships do is bring in outside resources that the county and the local health department were not going to be able to bring in. And so there's sort of the financial side of it too, where we as different types of entities have all these different for funding streams that a truly county public health department doesn't have, whether it's the structure of a critical access hospital or a structure of a nonprofit community health center, or some of just the other aspects, building healthy families, bringing some of those family services the health department do through the avenues they have been pretty impressive.
That's a good point.
Anything else out there? Come on. Folks, this is your chance. Community
I
health,
just want,
the public health
I
department.
just want
when
to
the-
I just want to put my motion out there because at points in time, more often than not these days, it kind of feels like we're beating our heads against the wall, just regurgitating the same message of get a vaccine, wear your mask, avoid crowds, wash your hands, all get tested early, all of the things that we feel like people have to be tired of hearing about by now because we've said them so many times. However, I live and breathe this every day. And so I'm always interested in hearing from the community what they feel like the message needs to be and the points that have not been made strongly enough. And so I would love to just throw my email address out if anyone hears of anything, feels, Rich and I had some great conversations last week about ways that he can help us and we can help him and trying to get our message out. But I just wanted to throw my email address out if anyone has any thoughts for PSAs that they feel like they need the community needs to hear. We certainly want to be providing that information to the community at large. And so my email address is simple. I'm Brooke, BROOKE .pace, PACE @wchcd.org. And I am all ears for suggestions in the terms of the types of information. Granted, we have some constraints with what is being released from OHA and mandates and the such, but would love to hear from anyone if they have suggestions on what this county needs to hear. That we, that maybe it's things that we've already said and you feel like need to be heard again and again and again.
So in my community of the vaccinated, we have some very, very frustrated people out there now. And one of the big areas of frustration is going into a store where employees are not vaccinated and customers are not vaccinated. The first time around, Safeway actually had somebody at the door. They don't now, but Safeway employees are good. They're vaccinated, they're masked. And I'd say that in Safeway, it's pretty good. Maybe 90% of the people are masked. Not so at a couple of other places. What do we do?
So this is a hard one, right? Because we have all these mandates and who's enforcing these mandates. So really, the only thing that you even have in your back pocket to be able to do is to form a complaint with OHA and or OSHA.
Okay.
And there's on the OHA website, there's a direct link to report instances like that. And we're Wallowa County. I always start with, you can tell the vibe of a place by if the people working are wearing masks. If they are wearing masks and you're seeing someone shopping without a mask, it's always just a nice courtesy to go talk to them about that. Say, hey, I see that we're not enforcing masks, and it could be that they just couldn't see it. I've received complaints here at the hospital about someone going on the walking path and taking their mask off when they were by themselves. So there's different degrees of that, but so we've been on the other side of it too, here at the clinics, especially when we were in a time when the hospital and clinics were the only place where we had really just had to be the opposing force for those people, have gotten beat up a lot over this. And it doesn't matter the amount of signs that you put up or checkpoints that you have to walk by, you still have people that are trying to test. And we of course have the different options for people who aren't able to wear a mask for whatever reason. I know that all of the clinics are doing curbside visits for outside of the clinic, so you're not exposing anyone. We have some face shields that aren't as constrictive as masks that are available to anyone coming into our clinics. But I think, just aside from just straight turning someone in right off, having a conversation with the worker business owner of what you're seeing, the poverty in our little community. And then also, make your shopping decisions accordingly. If you feel like there's a place that is not doing their part to keep our community safe, that's one control piece that you do have, is where you're choosing to spend your dollars.
Well, I think that's all good points. We know that officially, I do know that somebody actually wrote a letter to an absentee store owner here, and I don't think they got a reply. I've told one store that I'm sorry, if you're not masked, I'm not coming in here.
And on the flip side of that as well, we have received countless reports of people contacting us to let us know about these stores. And we are certainly, trying to do our best to make sure people understand the importance of masking, but that is not a role that the healthcare district, Winding Waters, any of us place to go and get these people in trouble or do anything in the form, that's just not our role. We're trying to help sick people and prevent people from getting sick, but in terms of enforcing masking, that's not something that we're able to do unless it's on our own campus.
Well, Brooke, I don't think he's a classmate of yours, but pretty close. But a friend of mine was worried about people visiting his mother without a mask. And they said, masks don't work to protect you from anything. And he said, they'll protect you from my baseball bat.
Oh, that's a good one.
If you're going to talk to my mom, you're going to wear
one.
with your mask. So anyway, that's another way of
Right.
another way of
Encouraging
handling
people.
it.
Sure.
And you might guess who it is. Anyway, I want to just thank you, Brooke, very much for doing this. Nick, thanks for jumping in there. And I want to say, and thank you, all of you, for coming along. Please pass the word along. I think that communication is the best thing we have going for us now. Rumors are always nasty, and they don't help anybody to solve problems, So my letter to the editor isn't going to make it in this week, but I'm saying basically we've got what Brooke was saying. We're a community here. We might root for Enterprise against Joseph for Wallowa, but if we're down in Salem, Enterprise and Joseph and Wallowa are all the same, aren't they? And one end of the county and the other, and we just need to all pitch in on this. So thank you all very much. And if you have other suggestions, Brent, let me and come and visit us. Wear your mask. Wear your mask, but come into the Giuseppe Center. There's really still some very nice artwork up from the Wallowa Valley Festival of Arts. And we've got some new wonderful stuff up in the library too. So come see us.
Thank you so much for having me.
Thank you, folks. Okay, I'm leaving. We're gonna finish her up, okay? Bye-bye, Brooke. Thanks again.
Thank you.